Welcome to this explainer. Today, we are unpacking something absolutely fascinating, a real game changer in modern healthcare that fundamentally shifts how we think about healing. We're going to explore Professor Rajeev Gupta's Integrated Medicine Model, or RGIM. Basically, we're looking at how this model safely and effectively combines the rigorous, hard science of conventional modern medicine with evidence-informed complementary and alternative medicine. And the goal here? It isn't just about treating your symptoms when you get sick. It's about completely revolutionizing patient care by building long-term physiological resilience. So let's dive right into this question, because honestly, it sits at the absolute core of why this entire model was developed in the first place. Are we treating illnesses, or are we actually creating health? Look, conventional modern medicine is incredible. It has completely transformed how we handle acute illnesses, severe trauma, surgery, emergency care, you name it. But it kind of struggles with something else. It really struggles with the residual, heavy burden of complex, lifestyle-driven chronic diseases. We're talking about folks who survive an acute event, but then they have to live with persistent fatigue, sleep issues, metabolic problems, or even the adverse side effects of taking multiple medications. To fix that, we need a massive paradigm shift. Think of the development of scientific, conventional Western medicine as the strict conductor of a giant orchestra. It ensures safety, it sets the baseline, and it manages the acute crises perfectly. Complementary therapies, on the other hand, well, they're the diverse instruments working together in harmony under that conductor's guidance. When they're properly coordinated, they help shift our entire healthcare approach away from just reactive disease management, waiting until you're already sick to treat you, to proactive health creation. That's where we actively build your biological resilience long before an emergency ever strikes. And this brilliantly illustrates that exact concept, the integrated medicine journey in action. Looking at this master map, you can see how conventional, evidence-informed modern medicine remains the absolute foundation. It sits right up there at the top of the hierarchy, completely responsible for diagnosis and disease-specific treatment. All the other modalities radiating outward, they are strictly adjunctive. They do not replace conventional medicine, they're there to support it. To really understand this whole ecosystem, we'll be traveling around 4 distinct branches of integrated medicine today. We've got Eastern and traditional modalities, body-based therapies, mind-body holistic approaches, and the Western conventional quadrant. Let's see how they all safely coordinate. Starting with Section 1, Eastern and traditional modalities. This is all about evaluating ancient wisdom through the lens of modern science. Now, what's really fascinating here is how traditional healthcare systems like Ayurveda are now being grounded in hard clinical science. Instead of just relying on historical texts, we can literally see how botanicals like curcumin and ashwagandha act at a cellular level. It's wild. Curcumin has been used for thousands of years, right? But it's only recently that we've mapped exactly how it inhibits inflammatory pathways molecularly. When carefully monitored to avoid any herb-drug interactions, these botanicals act as amazing adjunctive support for systemic inflammation and metabolic health. Again, without replacing your evidence-based medical treatments. Along with Ayurveda, we also see the integration of practices like Chinese medicine, acupuncture, Tai Chi, and Qigong. But here is the critical part. Under this model, acupuncture isn't used as some standalone alternative medical system. It's a targeted tool for pain modulation and autonomic nervous system regulation. Movement practices like Tai Chi and Qigong are incorporated for functional rehabilitation and balance. Even homeopathy, if a patient specifically chooses it, is integrated transparently under strict clinical governance. It never substitutes for necessary pharmacological or surgical interventions. These options aren't the Wild West. They are highly regulated, adjunctive tools. Moving around the wheel to Section 2, body-based and mind-body therapies. This focuses on the physical and mental rebalancing of the nervous system. In the Gupta model, osteopathy and chiropractic care have a very specific, evidence-based role. They are utilized strictly for specialized musculoskeletal rehabilitation. Think nonspecific low back pain or mechanical neck pain. The model completely avoids any of those unsupported claims you sometimes hear about manual therapy treating unrelated systemic diseases like asthma or hypertension. It is highly targeted, red flag screened, structural support. Full stop. Let's move over to mind-body medicine and look at therapeutic yoga. It isn't just a stretching exercise, guys. It is a profound physiological tool. Regular practice actively downregulates the body's inflammatory system. It reduces the stress hormone cortisol, it lowers key inflammation markers like IL-6 and C-reactive protein, and it combats oxidative stress right at the cellular level. That directly supports your cardiovascular and metabolic health. Following right on from that, these mind-body therapies also trigger incredible gender-specific neuroplasticity. By lowering that cortisol we just talked about, yoga helps upregulate crucial proteins like BDNF, brain-derived neurotrophic factor. Whether we're talking about reproductive age females experiencing peak estrogen or individuals navigating menopause or andropause, this process actively protects cognitive function and mitigates cognitive decline across entirely different life stages. Okay, on to section 3. Functional and nutritional pillars. This is where we target the root biological causes of chronic disease. Here, the RGIMM incorporates the absolute best of functional medicine by identifying and addressing modifiable contributors to illness, things like dietary patterns, poor sleep, stress, and gut microbiome health. But the key distinction you need to remember, it actively rejects any diagnostic testing or therapeutic claims that lack rigorous scientific validation. Everything, and I mean everything, must be evidence-informed and clinically appropriate.
Think of it this way. Nutritional medicine and dietary supplements are not just fuel for your body, they actually act as molecular signals. Through the science of epigenetics, the food you eat literally interacts with your environment to shift your gene expression in real time. They can suppress the genes that drive inflammation and activate the ones that prevent chronic illness.
Now, because we are combining so many powerful modalities here, the whole shebang, from pharmaceuticals to botanicals to manual therapies, safety is absolutely paramount. This is exactly why the model relies on intense cross-disciplinary training. Integrated pharmacists and community health navigators meticulously check for herb-drug interactions. Plus, every single practitioner is trained in what they call red flag recognition to safely identify acute conditions and immediately direct patients to specialists or hospital care the second it's necessary. Finally, Section 4, the AI revolution in proactive health, using digital biometrics as the connective tissue for this entire integrated model. Instead of relying on episodic hospital visits when you are already sick, AI evaluates your unique genomic, metabolic, and behavioral profile to pioneer what is called anticipatory medicine. It's all about shifting the focus. We want to spot that subtle, gradual transition from health to illness long before a formal disease diagnosis is ever made. So, how does this actually work in practice? Well, by continuously tracking data from your wearables and digital health platforms, AI establishes your personalized health baseline. It synthesizes all this data and performs predictive risk stratification. Because the system knows what is normal for you specifically, it can instantly spot out a subtle deviation, like a slow, creeping increase in your resting heart rate or disrupted sleep, long before it turns into a severe, acute clinical emergency. Check out this breakdown. When the AI flags an early warning sign, say an expanding waist circumference or persistent sleep disturbances, community health navigators step right in. They use clinical decision tools to trigger the exact intervention you need, whether that's an immediate cardiology referral, mind-body medicine, or nutritional therapy. The whole goal is to restore your health baseline before the disease can fully establish itself. What the Rajeev Gupta integrated medicine model ultimately proves is that your long-term health trajectory isn't just up to static genetics, and it certainly shouldn't just be about waiting around for a diagnosis. By combining the precision of modern medicine with evidence-informed complementary therapies, health becomes a proactive, daily journey that you actually control. So, armed with this understanding of how deeply interconnected your biological systems truly are, what step will you take today